knows how you come across somebody once in a while you shouldn't have messed with? That's me.
I am not an African American.
You're Oreo cookie, white in the inside and black on the outside.
I don't have an afro, I have an Amerifro.
Talking that idiotic stuff you talk about, I will slap you.
Go ahead, make my day.
Black as the ace of spades, but 100% American.
Heard around the world by everybody and their mama. The Jesse Lee Peterson Radio Show.
Uniting the races with truth instead of dividing them with lies. We're also rebuilding the family by rebuilding the man. I am Jesse Lee Peterson. Thank you so much for being with me. Welcome back. We're having a panel discussion about Obamacare. A lot of folks thought that during this last election campaign, that we would be able to get rid of Barack Obama, and in return, Obamacare would be overturned. That hope is out the window now. Folks don't know what to expect. A lot of employees are cutting back on hours or at least threatened to cut back on hours of some of their full-time employees because they simply cannot afford Obamacare. There's great concern about this. And, okay, let's go with Dr. Riley. We have Dr. Wayne Riley with me. He is the 10th president and chief executive officer of Meharry Medical College, located in Memphis, Tennessee, one of the major educators of minority physicians in the U.S. that focuses on training medical students to care for the underserved population. Dr. Riley has nearly 2 decades of experience in primary care and public health, healthcare management, and academic. Also, I have with me Dr. Jane Lindell Hughes, a board-certified ophthalmologist in private practice and is a clinical professor in the Department of Ophthalmology at the University of Texas Science Center in San Antonio, Texas. And Dr. Hughes has been with me in the past, and I'm happy to have both of them here today. Dr. Riley, good morning, sir. Welcome to the show.
Good morning, Reverend Peterson. How are you, sir?
All is well. Thank you for being with me. Dr. Hughes, good morning. Sorry about the confusion I'm having here.
Well, good morning, Jesse. I was trying to shout out which line I was on, but I don't have the screen either.
This is something new for me, so I'm learning here. I want to talk to you about Obamacare. As I said in the introduction, a lot of folks are very concerned about this, and they thought that if we could get rid of Obama, then somehow or another we can overturn Obamacare. But unfortunately, that didn't happen in that we did not get rid of him, so it looked like Obamacare is going to stay. Dr. Riley, you wrote an article recently for the Huffington Post, and it is called "The President's Re-Election Will Lead to a Healthier America." You believe that Obamacare is a good thing, and why do you believe that?
Absolutely, Rev. We look at it quite differently than a lot of the political pundits in terms of health care. Our institution has been among the leaders in addressing health care disparities, particularly in the African American communities all across this country. And one of the first ways that we can deal with health care disparities is to get access for African Americans and Latinos and others to health insurance. So that's why we have embraced the Obamacare, or the Patient Protection Affordable Care Act, its official legislative name, as you know, because we think it does make a significant start, not the total answer, but a start to dealing with health care disparities. The market approach, the pure market approach to healthcare disparities just has not delivered in the way that we all would have hoped. And so by the Obamacare scheme, there now is some reasonable hope that we can start to address healthcare disparities.
Dr. Hughes, how do you respond to that?
Well, I think we should acknowledge right off the bat that we all believe that the American healthcare system does need reform. However, Obamacare is not reform. It is a fundamental transformation of our American healthcare system into one that mimics the British system of socialized medicine. Now, I think it's important to go back and realize that when Obamacare was passed, 85% of Americans had health insurance, and they were happy with their insurance. And when you take a look at the 30 million uninsured individuals that was often used as a quote, when we broke down the demographics of those individuals, it really turned out that there were about 12 million people who were the working poor who fell between the cracks. These individuals actually could have been assimilated into our healthcare system without taking over the entire healthcare system. So the actual premise upon which the Obamacare law was brought into being, if you will, I think was questionable right off the bat.
Dr. Riley?
Well, I couldn't disagree with my learned physician colleague more. The 12 million that the doctor refers to, many are black and brown. And black and brown folks disproportionately are visited by diseases and a lack of access to healthcare services, in spite of the fact that we have the best medical care and the best healthcare facilities in the country. So from a narrow perspective by which we look at it and which I look at it, health insurance is the first thing that we can do to get medical care into black and brown communities all over this country. So I disagree with that approach. I understand it, but the market has not delivered in terms of dealing with healthcare disparities to date.
There's an aspect about Obamacare that is not discussed for some reason, and that is people who don't want to go out and buy private insurance will have to pay a fine. And to me, that seems unconstitutional that the government can force us to buy something, healthcare, when we don't want it, insurance when we don't want it. Does that seem right to you, Dr. Riley?
Well, the Supreme Court has spoken, so I don't think it really matters what my opinion is. The law of the land is that the individual mandate is constitutional by the Supreme Court. Now, one can quibble as to whether one should be compelled to get certain things in our society. In many states, we're compelled to get automobile insurance.
But if you didn't own an automobile, you wouldn't have to get the insurance. But in this case,
well, that is true. But we all own bodies, Rev, and all our bodies are subject to disease and to wearing down over time. And sometimes that wearing down and disease can be quite expensive, and it places a burden on those of us who pay for health insurance, when others who don't have health insurance end up in emergency rooms and in other settings that are far more cost ineffective to address. So again, Obamacare is a stab at trying to equalize the playing field. It is. I don't think the president himself would say it's a perfect bill. I think it's about 80% of where we need to be, and there's other 20% that we need to focus on, such as cost control.
Let me take a quick break. Let me take a break. We'll pick up on this. Dr. Hughes, I'll allow you to respond to that when we come back. Back in a moment. This is from the Daily Express, UK Daily Express. In a bid to save nearly £3 billion by slashing appointments with a doctor and treating patients by way of computer will put lives at risk. Ministers were warned. Health Secretary Jeremy Hunt is planning a technological revolution that could spell the end of the traditional doctor surgery. So what they're going to do now in the UK is treat patients by, is it called Skype, Andre? By Skype. So you can call your doctor up on the computer and say, I'm bleeding in my belly. What? Can you take a look at it?
Jesse,
Yes.
could Could I make a comment regarding the focus that Dr. Riley mentioned with Obamacare?
Yes, ma'am. Go ahead, please.
We cannot afford, in my opinion, to have such a narrow focus that we miss the fact that we already have a safety net, and that safety net is Medicaid. And Medicaid is set up to take the individuals who fall through the cracks in our healthcare system and provide them with health care. And you did mention, Dr. Riley, the emergency rooms. The emergency rooms do work. We do not have people on the street who are not receiving medical care. And I agree they are costly, but they are 7% of our overall health care expenditures. And actually 85% of people who go to the emergency room do have insurance. So we have a safety net already in place. This is a fundamental transformation between the doctor and the patient and their relationship. And it's also a fundamental transformation of the individual to the state. And it's a shifting of our American medical health care system to one of central planners and centralized decision-making. And, Jesse, you bring up a great point about the Great Britain system.
Yeah.
I have an actual first-hand knowledge of an example of how this rationing takes place. My son is an orthopedic spine surgeon in New York City, and he got a frantic call from a fellow whose father had been on a cruise with his mother, and he was elderly, and they rolled into Vancouver, hit a rogue wave, and he broke his neck. And the reason for the call was because the son said that the physician came in and said, well, you're elderly. He was otherwise healthy, by the way. He wasn't even on medication. You have a fractured neck, you cannot move, you cannot get out of bed, but we're not going to let you suffer. And they started end-of-life care, comfort care. So at any rate, the end of the story is he was airlifted out of Vancouver to New York. His neck fracture was fixed, and 6 weeks later he was back to ballroom dancing, consulting with the business he'd started, and walking his 5 miles a day in Central Park. So there are real consequences to this legislation, and we have got to be fully aware of those consequences for every single American while still being cognizant of the need for a safety net for those amongst us who are unable to take care of themselves.
You know, it's amazing, that story what you just shared with us. But the reality is that Obamacare is there now. What do? We can't, it's not going to be overturned, it seems. As Dr. Riley said, the U.S. Supreme Court has approved it. So what do we do? Well,
the ultimate implementation of Obamacare relies on the states. And right now there are 30 Republican governors who've written to Kathleen Sebelius in July, and they've asked for the outlines on what the mandates were going to be vis-a-vis the new regulations and the administrative burdens, not to mention the financial burdens, and they still have not received an answer. And the states are crucial for two parts of Obamacare's implementation. One is the establishment of the insurance exchanges, and the other is the massive expansion of Medicaid. And many states are already struggling with the financial burden of Medicaid, which is only partially funded through the federal government. And it's estimated, for example, in Texas, with full implementation of Obamacare and the expansion of Medicaid, that 100% of the Texas budget would be Medicaid. Obviously, this is not tenable. So these governors, there are 20 governors now who've declined to set up the state exchanges because they don't know what the implication for their citizenry is.
Dr. Riley, how do you respond to all this?
Well, I couldn't agree with Dr. Hughes more that the patient that her son took care of in a very fine hospital in New York is emblematic of the best of American healthcare. But the fact of the matter is, even in my former state of Texas, where Dr. Hughes lives, there are many black and brown citizens who don't get that level of care. And again, this is not a perfect bill, but I think it does begin to address in a very systematic way, in a free market way, by the way, because all of these new insurance customers will come not through the federal government per se, but through private insurers such as United Healthcare and Cigna and WellPoint and all the big names that we are aware of. They will have access to insurance markets through the insurance exchanges, and then they and their families can make decisions based on their circumstances of what level of care they will need for their family. Medicaid is a safety net. I agree fully. It is a fantastic safety net, but it doesn't reach as many people as we desire under the current scheme. And again, this is the beauty of the Obamacare scheme, is that the federal government will take up to about 90% of the excess cost of the expansion of folks onto the Medicaid rolls. Again, the 10% gap that Dr. Hughes highlighted does need to be addressed, and I think it can be addressed by the President and Congress and people of goodwill and in a bipartisan spirit to figure out how to close that little bit of a gap towards the back end of the decade. But most governors will agree that this is a decent deal to expand Medicaid and to get 90% of it paid for through the federal government.
Dr.
Well,
Riley.
I would have to disagree with that because most governors are very skeptical about the long-term support of the federal government. And if you take a look at a lot of the programs that the government will start paying for, and after years go by, especially I think this 90% matching was for the first 3 years of the program, gradually the responsibility is shifted to the states. But let's take a look at Medicaid and Medicare, which are the two government health insurance programs that the government is currently managing. Medicare is due to go bankrupt within 8 years, and Medicaid pays a lot of times lower than the actual cost of delivering the care. So it's becoming increasingly difficult for individuals who are already on Medicaid to find physicians who are willing or can take care of them and still keep their doors open.
Dr. Riley, let me just ask this quick question. You keep mentioning black and brown people, and I hear that a lot, and I think it's to draw a false sense of sympathy for these people. Myself and other normal people are sick and tired of taking care of the black and the brown. When I come back, I would like to know, how long do we have to take care of the black and brown? It's killing us to do that. I get a response when I come back. 888-7753-773. My final segment with Dr. Riley and Dr. Hughes about Obamacare. This is from Politico. The Supreme Court on Monday ordered the Fourth Circuit Court of Appeals to examine the constitutionality of the health reform laws, employer requirement, and mandatory coverage of contraceptives without a copay. The move could open the door for President Barack Obama's health law to be back in front of the Supreme Court late next year. So that sounds pretty good. Dr. Riley, respond to my question, and then I would like to give you guys a chance to give out your website. I am personally, and other hardworking, normal Americans are tired and fed up of taking care of the black and the brown. It's like having a family member in your home that will not move out, and you feel like you got to take care of them in the rest of your life. I'm sick and tired of it. What do you say to that, Dr. Riley?
Well, Rev, I defer to you in terms of the moral and theological angles in terms of taking care of the least of these amongst us. But as a physician,
but not for life.
I know that many inner city Latinos and African Americans, no matter how hardworking they are, sometimes don't have access to the great healthcare services that Dr. Hughes mentioned that her son provides at a great hospital.
But they do have
access.
access.
And that's where I think our point of departure is. This bill is a good bill. It's not perfect, but it over time it will have, in my view, the impact on improving the health of all of us, not just black and brown, but all of us.
But the quality of health care is going to go down in a socialized, whenever you have socialized medicine, it devalues. And the people with money are going to be able to afford to buy better health care than those without the money, so it's not going to improve in that way at all. Am I wrong about that, Dr. Hughes?
No, you aren't wrong. Our point of departure is that, in essence, you're saying that this law, which is 2,700 pages, which creates 156 new bureaucratic agencies, which hires 16,000 more IRS agents so that they can monitor individuals, their purchase of health insurance, what their income is the solution and is going to solve our health inequities and the cost problem in the United States of America. My point of departure is this is not going to solve our health care problems. There were good solutions. They were not articulated well, but they were there. They continue to be there. And this law threatens the sanctity of the doctor-patient relationship, and it transforms how we view the individual case by case by case. And so I don't think it's going to accomplish for the blacks and the browns and the Caucasians and whatever ethnic group you want to break people down into who are underserved, to use your term. I don't think this law is going to accomplish that. We all want to take care of those amongst us who cannot take care of themselves.
But not for life, though. I'm sick of it. I don't want to take care of my children once they become adults. So I definitely don't want to take care of some other black and brown folks. Dr. Hughes, do you
again, my respected colleague, we differ. This is a good bill. We're going to have a healthier America because of the President of the United States and what he has done. And over time,
Dr.
this
Riley,
bill will be embraced just like Medicare is now warmly embraced. Remember, Medicare was a very controversial program when President Johnson signed the bill, and I think time will prove its durability.
We're running out of time. Dr. Riley, you're supporting Obamacare when it is forcing insurance companies to cover people, and in return, this would put businesses out of business, and I don't know why you would support such an evil law.
Just read the law, Rev. It's a good bill, and I think, again, my view and the view of the people that we serve in this great institution called Meharry Medical College, it will lead to a healthier America.
What's your website, Dr. Hughes?
Well, what I'm going to say, Dr. Riley, is this. We can listen to rhetoric, and you can say that it's a good bill, but it is costing jobs. It places a tax on innovative medical equipment, and actually Zimmer, which is a big medical equipment company, and Stryker, between the two of them, have laid off over 2,000 people in response to this. There are 20 million people who are going to lose their employer-based health insurance from this bill, and there are millions more who are going to be placed on part-time status so that employers are able to avoid the escalating cost of the new insurance mandates through Obamacare. Dr.
Hughes, your website real fast? Dr. Hughes?
Yes?
You have a website you'd like to give out?
Yes, go to ads4truth.org.
And Dr. Riley, your website?
Yes, www.mmc.edu, Meharry Medical College.
Thank you guys for being on with me.
Thank you very much.
Good discussion.
Thank you, Jesse.
All right. I'll take some calls when I come back.